Welcome back everyone. My name is Daan and I am a medical doctor from the Netherlands and a certified psychedelic therapist. In the next few videos I would like to get into specific mental health conditions and how psychedelic therapy could help with these. To start it off, we'll begin with depression and why there's such an urgent need for better treatments than the ones that we have today. Now, depression is extremely common. Around 15 to 20% of people in the Western world will experience it at some point in their lives. So that means that most of us either directly know someone that has had a depression or even have experienced it or will experience it ourselves. But what many people do not realize is how bad it can get. And that's because people with a severe depression, which is about half of the cases, are generally not people you see out in the world in everyday life. These are people who are often not going to work, not taking care of themselves and barely managing to get by to do the most basic daily tasks. They can literally spend entire days stuck in their own minds, feeling terrible and ruminating for hours and hours about how hopeless their life is. And for many of those people, ultimately this leads to thoughts about ending their own life or even taking actions to do so. Because very tragically, suicide is one of the leading causes of death in people with a depression, and actually the #1 cause of death for people with a depression that are under 65. And this is very, very personal to me, because that's how I lost my own father. That was doing the usual treatments, but they just couldn't help him enough. So that became a very big motivator for me to start looking for more effective treatments. Now, because of how common it is and how much suffering it causes, in 2017 even the World Health Organization declared depression as the leading cause of ill health and disability worldwide. So let's hopefully all agree on this, that for the medical condition that currently causes the most suffering and disability worldwide, and that keeps on growing year over year, new and better treatments are not a luxury, right? They are an absolute necessity. And let's get into that by first looking at the main 2 treatments that we currently have and why for many people they're still not enough. The first one is psychotherapy, seeing a psychologist to explore your life situation, understand what's contributing to your depression and then actively taking steps to change those things. Now, in many cases this is actually the most effective treatment that we currently have, because very often, of course, there is a reason that people become depressed. In a way, you could think of a depression as an inner alarm system or a kind of compass that is telling you that your ship is heading in the wrong direction. The job in therapy then becomes to really listen to that signal and to slowly adjust the course of your ship. And that's why therapy can be so powerful. When it works, the effects often last, and that's because people actually change their lives. But therapy also has its limitations, and the main one is it requires a lot of effort up front. You have to find a suitable therapist, you have to go there regularly, you often have to pay for it, and you have to do the work during the sessions and just as importantly in between the sessions in your real life. And if you do all of these things, it usually still takes many weeks to months before you really start to feel the benefits. Now, as you can imagine, this is hard. And for people who are severely depressed, who may not even be able to properly take care of themselves, this can be incredibly hard to do. So while therapy can work very well, it does require a lot of effort up front, which is not something that everyone is capable of doing. The second main treatment that we use today is antidepressant medication. And there are many different types of these now, but even though they're different drugs, most of them work in a very similar way. They increase the availability of certain neurotransmitters in the brain, mainly serotonin, but also dopamine and noradrenaline. And that then produces an antidepressant effect. Now, a quick side note here, because for a long time people believed that depression was caused by a deficiency of these neurotransmitters in the brain, and that antidepressants would then correct that deficiency, restoring the brain to a normal state. Now, that was a nice story and it sure helped sell a lot of pills, but that theory was never proven. And today large studies show that depressed people don't simply have too little serotonin in their brains. That story is just not true. But still, artificially increasing these neurochemicals can reduce depressive symptoms. And let's get into how it does that using the same analogy as before. So if a depression is like an alarm system or a compass that is warning you that something is wrong, that your ship is headed in the wrong direction, antidepressants don't fix the direction of the ship, but they turn down the volume of the alarm. And that can feel like a big relief in the short term. You feel less overwhelmed, less anxious, less hopeless, and less depressed. But the alarm was also there for a reason, you know, and if nothing in your life actually changes and you just suppress the alarm system, well, your ship might go further and further in the wrong direction. And that's unfortunately how these drugs are used very often these days, by just suppressing the alarm while not addressing the underlying problem. Also, because the brain adapts to these medications, the alarm will become more and more sensitive the longer that you use them. And if you then try and get off the medication and you haven't adjusted your life, well, the alarm will go off even harder, which is the rebound of the depression that so many people experience when they try to get off these drugs. Another very important part of the story is that for many people, antidepressants don't bring a full recovery. They do reduce the intensity of symptoms, but they don't make people feel truly well again. And patients often describe this as feeling less bad, rather than actually feeling good. In fact, that's one of the main side effects of these drugs. They can often blunt positive emotions just as much as they blunt the negative. And there are many other side effects. The most common ones include sexual problems, sleep issues, weight gain, emotional blunting, and feeling dependent on the medication. And these are not rare at all. Actually, most people that take an antidepressant experience at least some of these side effects. And for a very significant portion, 30 to 40%, these side effects are severe enough that they have to stop taking the drug. I'm not saying that antidepressants are bad. They can indeed be helpful, and I've seen that plenty of times in clinical practice, especially for people with a severe depression. But what I will say is that they are far and far from perfect. They don't work for a lot of people, and even when they do, they usually just reduce symptoms rather than bringing a full recovery. They have lots of side effects, are hard to get off of, and they don't help you fix the underlying problem. And lastly, they can take a long time to start working, often 1 to 2 months before you really start to see the antidepressant effect. And in the early phase of taking them, some patients, mainly young people, may actually experience an increase in suicidal thoughts and behaviors, which is why very careful monitoring is so important with these drugs. So, to summarize, depression is the medical condition that currently causes some of the most suffering and disability in the Western world. And the main two treatments that we have today, therapy and antidepressants, help some people, but many are not helped enough, not helped fast enough, or are limited by side effects. And that's why finding new treatments that work better, faster, and with fewer side effects is so important. If we go back to our analogy, depression is like an alarm going off on the inner compass that guides your life. Therapy slowly adjusts the course of your ship. Antidepressants just turn down the volume of the alarm. Both can be helpful, but both also have significant drawbacks. Psychedelic therapies are different. Why? Because they can help you do both at the same time. They really shine in helping you see where your ship has gone off course, and then even assist you in making changes in your life. And at the same time, they rapidly make you feel better. Interestingly, not by turning off the alarm directly, because that would blunt your emotions, but by helping you step outside of the thought loops that trigger the alarm. In the next video, we will review the scientific evidence there currently is for psychedelic treatments for depression. And I will show you how psychedelic therapies often provide fast relief with few side effects and helping a much larger proportion of people than the treatments that we have today. I hope this was all helpful to you. If anyone has used a psychedelic to treat their depression, I would love to hear about it. Please don't forget to subscribe. Peace, and see you next time.